Hi everyone, this is Maz from AFKprep. We try to record the video for pharmacology. This is our first trial, so let me know how you like it. Then we can probably make some more relevant videos. So the first question for the AFKprep from pharmacology is read through the question first on the left side and then we'll go through the options. So the first question says that 29 years old male with a history of chronic renal failure and renal dialysis presents to your clinic for extraction of third molar. All of the following are precautions needed to be taken except. So this is a question that asks for exception. So what are the precautions we need to take if the patient who presents with a chronic renal failure to your dental office? So the first option is avoid NSAID drugs from medication. What I know from my background knowledge, yes, NSAIDs are kind of nephrotoxic drugs. So this option could be correct. The second option is consider hepatitis B screening before procedure. Third option is proceed with extraction on a day before dialysis. And option D is half-life of penicillin G can increase from 30 minutes to 10 hours. And the fourth option is ceftriaxone antibiotic is a safe drug in this patient. So what I know from background knowledge, all NSAID drugs are nephrotoxic and therefore they should be avoided in a renal failure case, or at least we need to adjust the dosing of NSAID drugs in this patient. Consider hepatitis B screening. As you can see in the hepatitis B, all these drugs use catheter and they are prone to hepatitis B, so it is required to screen the patient for hepatitis B before going for dental procedure. The fourth option is half-life of penicillin G. We know that penicillin G is metabolized in the kidney. Since the kidney is been compromised, the kidney function is compromised. So as a result, penicillin G can be impaired its metabolism in the kidney, so therefore its half-life can increase from 30 minutes up to 1 hour or up to 10 hours. Last but not the least is ceftriaxone. Ceftriaxone antibiotic is a safe drug in this patient, while all cephalosporins they are metabolized in the kidney. However, ceftriaxone is the only cephalosporin drug that is metabolized via the bile. So this is the safest drug in the patient. So the answer here is option C, which is proceed with extraction a day before dialysis. So this means that actually we do extraction a day after dialysis, because in the dialysis we give a heparin drug in the AV shunt, which can cause thinning of the blood, and however once we do the dialysis it eliminates the fluid overload in the patient. So this is the best day to do the extraction. Let's go through. This is the exact explanation for this question. You can pause the video and read the entire explanation. The second question is, a 65 years old female presents to her office for extraction of lower right first molar. She reveals that she is currently taking the following medication: Residronate 35 mg per oral once weekly, along with calcium 1250 mg supplement for the rest of the 6 days. So what is the major side effect of this drug Residronate? So basically this question asks about the side effects for the Residronate. as we can all know, rezidronate, pamidronate, alendronate, these are all drugs that ends in dronate. They are all bisphosphonate drugs. So we know that one of the side effects of bisphosphonate drug is osteonecrosis of the jaw. So if we go look into the option uh, here, option C says osteonecrosis of the jaw. So this is for sure. So now let's look into the other options. Option A, esophagitis, esophageal ulcer. Option B is osteomalacia. Option D means A and C, and option E is all of the above. So we know that risodronate is also known for causing esophageal ulcers. And one of the reasons for this is when you ask the patient to sit upright and have this medication. So these are the two options, the two side effects of the risodronate. Is include esophageal ulcer and osteonecrosis of the jaw. Now we are left with option B, osteomalacia. Osteomalacia is the side effect of one bisphosphonate drug, which is known as etidronate. So you can see in the explanation that risodronate is a bisphosphonate drug associated with esophagitis. In order to avoid this side effect, patients should stay upright for 30 minutes after taking risodronate. In addition, all bisphosphonates cause osteonecrosis of the jaw. Osteomalacia is the only side effect associated with etidronate. So another thing I would like to mention is for the AFK, also remember the indication for bisphosphonate drug. So these are the postmenopausal osteoporosis, Paget's disease of the bone, prevention of bone metastasis in malignancy, and the prevention of hypercalcemia. So now let's go to the third questions. The third question says that a 35 years old female presents with the following chief complaint: pain on the right side of the face, swelling inside the mouth, and limited mouth opening. On clinical examination, you find soft, mild tenderness, swelling on the right side of the face, trismus 22 mm, largely carious first molar, tenderness to percussion on the offending molar, swelling of the buccal vestibule on the affected side. Vitals are recorded as 101 degree Fahrenheit with a pulse of 105. This and respiratory rate is 16 breaths per minute. So what is true about local anesthetic injection? As we can see into the question, the patient is presenting with some kind of infection, and the infection is not just limited to the mouth, but it has been extended beyond the bone into the buccal vestibule, and maybe has also, so it is tilting towards cellulitis, although it may not be an exact cellulitis. It could be an inoculation, which is the first stage of the infection into the bone and beyond. And the patient presents with a high fever. So in this case, the patient is actually the question is asking about the injection of local anesthetic in this patient. So the option is says effects of local anesthesia will decrease in inflamed tissue. It looks correct. Local anesthetic is dispensed as a weak base solution. So what we know that local anesthetics are all weak bases. However, when they are dispensed as a salt, an acidic salt like HCl, for example. So the weak base, so local anesthetics are combined with an HCl salt. So it is basically an acidic salt. Local anesthetic is indicated without epinephrine. As we can see, there's infection present in this patient, and with infection there is a vasodilation and increased blood flow to the infected area. So there's increased blood flow, and we need epinephrine in infected site so that it can cause vasoconstriction and tends to accumulate the local anesthetic in the infected area. So this seems incorrect. Local anesthetic is responsible for binding sodium channel in the nerve. In the bracket it's a base component. So we know that local anesthetic, it is basically dispensed as a salt, HCl salt. However, uh, with the sodium channel, it is combined as ionized form. So the base component is basically an ionized form, but however this is something we need for the penetration into the lipid bilayer. So this seems incorrect. This option C seems incorrect. Option B also seems incorrect. So the best answer choice is effect of local anesthesia will decrease in inflamed tissue. So the option A. So I would like you to read this slide, and for further explanation, I want to show you one thing here in this picture. As you see, this is a lipid bilayer structure, and then we have a local anesthesia, and this is the ion channel, which is a sodium ion channel basically. So the action of local anesthetic is it is converted from ionized to unionized form, and this is basically the unionized form or the base component, which is the lipophilic, and it tends to cross the lipid bilayer. So once it crosses the lipid bilayer, it combines with a hydrogen ion again inside the cell, so it becomes ionized again. So this is the ionized form that basically blocks the sodium channel. So we have always remember the unionized form, it crosses the cell bilayer, lipid bilayer, while the ionized form, it combines with the sodium channel. So when there's an inflammation in the tissue, there's increased acidic environment, which means there's more hydrogen ion outside the cell. So the hydrogen ion, when they're combined with the local anesthetic, this reaction goes backward. So when it goes backward, it forms more ionized form. And remember, the ionized form cannot penetrate the lipid bilayer. And once it cannot penetrate the lipid bilayer, these ionized form, the local anesthetic cannot work on the sodium channel. So that's the reason in the inflamed tissue there's a high acidic environment, and the local anesthetic tends to stay within the ionized form instead of the unionized form. And that's the reason the local anesthetic is ineffective in the inflamed tissue. So this is all for today. We will go through more questions and video. So stay tuned. Thank you.